But I want to talk about Senate Bill 352. And Senate Bill 352 was crafted in the acknowledgement of the opioid epidemic that we started working on over 3 years ago. And we have had forums literally all over the state of Georgia. And this is not these senators that are standing up here. This is not their bill. This is not my bill. We have heard not from hundreds of people, but from thousands of people. The very first forum we had in Gwinnett County, there was over 500 people who attended. We started having these forums in the metro area in Gainesville, Cherokee County, Forsyth County, and then we started migrating down to Tifton and Albany. And these recommendations, these prioritizations are what the people in the community have come up with and said, this is what we need, this is what the state of Georgia needs. And as the Lieutenant Governor talked about, the statistics and the death rates that have increased from 1.4% to 9.5 individuals per 100,000 from 1999 to 2016. The Department of Public Health reported that in 2016, opioid-involved overdose accounted for 2,435 emergency room visits and 929 deaths. That's absolutely incredible. We've done phenomenal work with naloxone and Narcan and improving that, but we felt like this bill takes it a step further. The one part of the bill is called patient brokering. And patient brokering is when a healthcare facility pays individuals a referral fee for sending an addict to their treatment program. And you think, well, that really doesn't happen. But I pulled a quote from an attorney who is the prosecutor in Palm Beach County, Florida. And he says, many so-called sober homes in Florida are nothing but flop houses, said David Ehrenberg, the state attorney for Palm Beach County, the only county in Florida that has a task force aimed at addiction treatment and sober home fraud. And that's what this is called, sober home fraud. And what he referred to as the Florida Shuffle. And who do you think would be the reciprocal state? Unfortunately, because we're the neighboring state of Georgia, that's why we are targeted. A patient gets a free one-way plane ticket to Florida, goes through treatment covered by insurance, and needing a place to live is referred to as sober home. But when those benefits are exhausted, the individual leaves the sober home. If the patient relapses, however, the patient gets treatment again. So rogue providers make sure drugs are accessible in those sober homes to ensure relapse and continued profits. 75% of private pay patients in Florida centers come from out of state. 75%. That's a phenomenal number. The second part of the bill is the Commission on Substance Abuse and Recovery, and it really fits and dovetails into Senator Burke's bill. There are so many state agencies that when we started working on this issue, that every state agency, just like we were talking about criminal justice reform, there's not an agency in the state that's not touched. And this is the whole purpose of creating this council. It will have an executive director, and all summer and all fall I've been calling it the drug czar, but the official title is the executive director, director of substance abuse, addiction, and related disorders. And we're not unlike other states that are having to do this, like Kentucky, West Virginia, and Indiana, that have already formed these. Excuse me, my notes are a little bit off. The last part of the bill is what we really heard from the families. A lot of families, like this young lady standing right here, are going through recovery. And unfortunately, when you see a lot of money dumped into an epidemic, there are people who try to capitalize on it. And it involves lab testing, where repeated tests, unnecessary tests, are ordered on urine and blood, and they run up the cost. And not only are those families complaining, but insurance companies are complaining, and that's one of the main drivers of running up the cost of health care, is people exploiting on an issue. So it's a comprehensive bill. We'd be glad to go over it and answer questions after that.